My topic is leukopenia. And in this, we're going to talk about the definition of leukopenia, the types, clinical manifestation, diagnosis, treatment, management, prognosis, and complications. So we'll start with leukopenia. First of all, what is leukopenia? Leukopenia is a medical condition where there is lower than normal white blood cells. In the normal count is 4 to 9 times 10 to the power 9 per liter, meaning in every liter of blood you have 4 to 9 times 10 to the power 9 white blood cells. And also, you know that white blood cells are important for the immune system. So if they are lower than normal, there's increased risk of infection. Then this is just to give you a general overview of what leukopenia looks like as opposed to normal blood cells. That's the erythrocytes and then the white blood cells. But here you can just types of white blood cells. We have neutrophils, lymphocytes, monocytes, eosinophils, basophils. So neutrophils are the first responders to infection. We have lymphocytes, which are involved in adaptive immune response. Monocytes, which differentiate into macrophages and dendritic cells. Eosinophils, which combat multicellular parasites and certain infections. And basophils release histamine during allergic reactions. Then we have types of leukopenia. As the name suggests, we have neutropenia, which is decreased neutrophils. Neutrophils are a type of white blood cells, and it increases risk of bacterial infections. Lymphocytopenia is decreased lymphocytes, increasing risk of viral infections. Then eosinopenia, decreased eosinophils, which are involved in allergic response and parasitic infections. Monocytopenia is decreased monocytes, involved in immune defense against pathogens. Basopenia is decreased basophils, which contributes to inflammatory response. Then this is leukopenia and leukocytosis, but we're talking about leukopenia. Then we have causes of leukopenia. We have bone marrow disorders. Conditions like leukemia and aplastic anemia can impair white blood cell production, causing leukopenia. So we have aplastic anemia, which is failure of the bone marrow to produce enough blood cells. We have leukemia, which disrupts normal blood cell production, and myelodysplastic syndrome, which is ineffective hematopoiesis, causing abnormal blood cells. And more causes, we have autoimmune diseases like lupus, rheumatoid arthritis, which destroy white blood cells. We have infections like viral, which are HIV, hepatitis, bacterial like tuberculosis or TB, which cause leukopenia. Then medications, chemotherapy agents, and specific antibiotics can suppress bone marrow function and can lead to leukopenia. Nutritional deficiencies like vitamin B12 or folate can affect white blood cell production, leading to leukopenia. Then clinical manifestation, we have increased susceptibility to infections. So if you have leukopenia, you are more susceptible to infections. Like your wound will take longer to heal, and symptoms are often asymptomatic, but then they may show in fever, fatigue, mouth sores, and sore throats. And the signs will be in decreased white blood cell counts, which can be observed through blood tests confirming leukopenia. Then diagnosis, complete blood count. It's a test to know the amount of the white blood cells present in the blood. Bone marrow biopsy assesses structure and function of bone marrow to identify underlying disorders, and additional tests like viral serologies, autoimmune panels, and cultures to test the white blood cell based on the suspicion. Then treatment and management. So to manage leukopenia, you have to first address the underlying cause, like what causes the infection. You have to address the medication or manage the autoimmune diseases contributing to leukopenia. Supportive care like monitoring for infections and providing prophylactic antibiotics when necessary. Lifestyle modifications. The patient should practice good hygiene and avoid coming close to people who are sick to reduce their risk of infection. Nutritional support. They should take essential vitamins to replace what they are deficient in, like vitamin B12, folate, and other minerals to improve white blood cell production. Prognosis and complications. So it varies based on the underlying causes, and it may resolve with treatment, while others may need long-term management, so they might not necessarily be treated. Ongoing monitoring involves monitoring the white blood cell levels, and adjusting the treatment as necessary. Complications can be severe and septicemia, which are potential risk with the untreated leukopenia if it's left untreated. Then conclusion. So leukopenia is a significant condition that affects the immune system, as said earlier. Early recognition and management is important to prevent complications, and importance of awareness is understanding leukopenia. Understanding leukopenia can help you recognize the symptoms early and to seek the appropriate care to prevent it from becoming more severe. Thank you.